Item number 2, SB24, Hill, electronic cigarettes licensing and restrictions. Good afternoon, Senator.
Good afternoon,
welcome.
Mr. Chair. Thank you.
Please present.
Thank you. I would like to accept the recommended amendments to make my bill consistent with Senator Hernandez SB151, which increases the minimum age to purchase or consume tobacco from 18 to 21. The amendments make certain that change also applies to e-cigarettes. Last week, this committee voted to pass out Senator Leno's SB140, which would define electronic cigarettes as tobacco. I share Senator Leno's concerns about the potential harm of e-cigarettes, especially the increase of their use by children. And that's why I introduced SB24 on the very first day of the legislative session. My bill differs only slightly from Senator Leno's bill, the only difference being my bill retains the existing definition of an e-cigarette that was supported by multiple health groups when it was put into state law in 2010 and is in state law today. Let me tell you what else my bill does. It makes e-cigarette retailers subject to the STAKE Act, California's premier law to prevent youth access to cigarettes and other tobacco products. The STAKE Act has decreased illegal tobacco sales to minors in California from a rate of 37% in 1995 to 8.7% in 2012. By including e-cigarettes in the STAKE Act, the Department of Public Health will be able to conduct stings on e-cigarette retailers using youth decoys to catch retailers selling to minors. Retailers who are caught selling e-cigarettes to minors will be subject to the STAKE Act penalties, including fines, licensure suspension, and/or revocation. SB24 also requires retail licenses through the Board of Equalization for e-cigarette retailers, which means the state has an enforcement mechanism if a retailer is caught selling to a minor. The retailer's license can be suspended or revoked. SB24 also includes e-cigarettes in California's Smoke-Free Act, which means that e-cigarettes cannot be used at places of work, schools, daycares, restaurants, bars, hospitals, and on public transportation. The bill also requires that e-cigarette liquids be equipped with child-proof packaging. This is important because more and more kids are getting poisoned by e-cigarette liquids. Children can easily open and ingest the often fruit-flavored e-cigarette liquids, which can be toxic even if ingested in small amounts. Just 1 teaspoon of liquid nicotine can be deadly. In 2012, there were 28 calls to the California Poison Control System for liquid nicotine poisoning, 28 calls in 2012. Last year, there were 243 calls. At least 60% of the calls were for children 5 years old or younger. Finally, the bill allows local preemption. If local governments want to regulate e-cigarettes more strictly, they are free to do so under SB 24. You will hear from health advocacy groups today who are in opposition to my bill. They want my bill to define e-cigarettes as a tobacco product. That is a separate policy debate for a separate bill. I'm focusing on youth prevention and vaping in public places because I've been working on tobacco reform since 1994, when as mayor of the city of San Mateo, I authored one of the first state's anti-smoking ordinances. In 2012, my Assembly Bill 1301 was signed into law, requiring the state to suspend and revoke a store's tobacco license if it repeatedly sells tobacco products to minors. SB 24 uses the existing e-cigarette definition that was established by the legislature in 2010. It says an electronic cigarette is a device that can provide an inhalable dose of nicotine by delivering a vaporized solution. When that definition was put into law, it was not opposed by any health advocates. In fact, several health advocacy organizations supported the definition. The health groups opposing SB 24 think the bill is a step backwards in regulating e-cigarettes. This argument is false and frankly misleading because it's based on the health groups' national campaign efforts to regulate electronic cigarettes. As legislators, we have no obligation to achieve their campaign goals. Our obligation is to protect the health of our constituents in California, and I ask that you consider whether each provision in my bill is an improvement over current law. There's no debate that SB 24 improves the way we regulate e-cigarettes to prevent youth vaping and protect public health. There are a number of tobacco control bills in the legislature this year, including my bill, Senator Leno's on electronic cigarettes. At the end of the day, no one knows what will happen to all of our bills. I certainly hope they all pass. But just because there are other bills on e-cigarettes does not mean my SB24 shouldn't move forward. It is in the legislature's best interest to keep multiple options on the table. My bill will prevent kids from getting their hands on e-cigarettes, which could create an addiction for the rest of their lives. The bill will protect public health by preventing the use of e-cigarettes in bars, restaurants, hospitals, and other places. I now would like to turn to those in support, and I would respectfully ask for your aye vote.
Thank you. Anyone like to speak in support, please come forward, state your name. Welcome.
Thank you. Cindy Wilson, representing the State Board of Equalization. The board is supporting SB24 if the bill is amended to provide adequate BOE funding for the expansion of the licensing program. Thank you.
Thank you. Anyone else in support? Opposition? We're going to limit the opposition to a total of 9 minutes.
Good afternoon, Mr. Chairman and committee. I'm Stefan Didak, and at this point I might actually get a second apartment in Sacramento, given that I'm spending so much time here. I'm here once again as the co-president of the Northern California chapter of SVADA, the Smoke-Free Alternatives Trade Association, and representing the Northern and Southern chapters and its more than 110 members. I still operate in the capacity of one of its unpaid volunteers, and I've never taken any payment from either this industry or the tobacco industry. We're very appreciative of efforts to distinguish e-cigarettes and vapor products from tobacco in parts of this bill, which is appropriate considering the well-documented harm that tobacco smoke causes. But we're concerned that in its current form, the bill will result in unintended consequences for the small businesses that make up the vapor products industry and their customers. So I'm here today with a position of oppose unless amended on SB24. Some of the language is unclear or ambiguous. For example, while the bill provides a clear distinction between vapor products and tobacco products in some sections, it maintains provisions that designate vapor-specific businesses as a tobacco store. There are also some technical aspects, as the reference to child-proof packaging shows. The bill should instead refer to child-resistant packaging as defined by existing federal standards, in particular the Poison Prevention Packaging Act. We support and accept the proven and tested standards as it provides a uniform federal standard and believe that clarification of this will actually strengthen the bill. There's a likelihood of unintended consequences as this bill attempts to extend the Health and Safety Code's definition of electronic cigarette into a very broad definition and will cover other smokeless products, including inhalers with or without nicotine, that do not or may not produce any vapor. Future products may fit the broad definition, but likely will not fit the spirit. SVADA believes appropriate and proportional regulation is pivotal to the success of the industry. However, we're very concerned about the licensing requirements as currently reflected in the measure that we strongly oppose a licensing requirement that resembles or reflects requirements for tobacco. We're willing to engage in discussions regarding a licensing scheme that is appropriate for vapor businesses and would like to re-emphasize the overall need to be clearly distinguished from tobacco in all sections of law. None of the small businesses that make up the vapor products industry have any ties to any tobacco companies, and vapor products contain no tobacco. It would be like referring to a caffeinated soda as a coffee product. Considering that vapor products provide an alternative to smoking and are widely recognized as being safer than combustible tobacco, we would like to register our concerns about the broad statewide public use bans set forth in this bill. Those are intended for combustible tobacco and should not be wholly applied to the use of vapor products. While we're opposed to SB24 unless it's amended to address our concerns, I'd like to make it very clear that we're solidly in favor of prohibiting sales to minors as evidenced by our industry's participation in the age-to-vape age verification program, and we're willing to work with the legislature on that concern. I believe we have an opportunity here to engage in conversation regarding our points of opposition and work towards a bill that we could either be neutral on or actually support, as a step in the right direction of having a statewide delineation between vapor and tobacco products. As currently drafted, however, we respectfully request that you vote no on this bill. Thank you.
Good afternoon, committee members. I'm Liz Williams with Americans for Non-Smokers' Rights. We're a national public health nonprofit based in California. While we support Senate Bill 24's intent to regulate e-cigarettes, we oppose the bill as it is currently written because it does not define e-cigarettes and other electronic smoking devices as a tobacco product, nor does it define smoking to include the use of e-cigarettes. We believe that the bill is being sponsored for all of the right reasons and that there is no harmful intent, but good definitions are critical. We are very concerned that the language in SB24 could unintentionally support the determined efforts of e-cigarette companies, tobacco companies, and their allies like the American Legislative Exchange Council to enact industry-friendly laws that are based around defining e-cigarettes separately from tobacco products. E-cigarettes should be regulated in the same manner as tobacco. Separate definitions make it easier to exempt e-cigarettes from current or future laws that address sales, tax, or where the products can be used. SB24 should not be inadvertently used to undermine California's tobacco control laws. When California prohibited the sale of e-cigarettes to minors in 2010, we didn't know that tobacco companies, most of which now own e-cigarette brands, and their allies like ALEC would promote the use of separate definitions as a means to limit the strength and effectiveness of tobacco control laws. As a result, some states explicitly prevent e-cigarettes from being regulated as tobacco, and some are also preemptive of local laws. In California, communities are leading the way. Nearly 140 California municipalities regulate e-cigarettes, including more than 60 that prohibit their use in smoke-free venues. These laws, by and large, treat e-cigarettes as tobacco products and as smoking. We don't want the legislature to enact language that is at odds with the strong, innovative laws that are being adopted by cities and counties. It's also important to note that the FDA announced its intention to regulate e-cigarettes as a tobacco product, and it's in the process of doing so. The fact that the FDA considers e-cigarettes to be a tobacco product is further reason that California should not treat e-cigarettes separately. We urge you to amend the bill to define e-cigarettes as a tobacco product so that we don't inadvertently create opportunities for e-cigarettes to be regulated differently than tobacco or run counter to the strong public health precedent being set by communities. Thank you.
Good afternoon, Mr. Chair and members. I'm Tim Gibbs with the American Cancer Society Cancer Action Network, and we are opposed to this legislation because it does not define e-cigarettes as a tobacco product. The 2010 definition of e-cigarettes that was referenced, we don't consider adequate any longer as the technology has gone so much further in the last 5 years. The nicotine in e-cigarettes is derived from the tobacco plant. Without tobacco plants, there would be no electronic nicotine delivery devices like e-cigarettes. Both Altria and RJ Reynolds acknowledge on their website and on their packaging that e-vapor products are tobacco products. And in 2009, NJOY sued the federal government claiming to be a tobacco product to evade regulation. Now they are arguing precisely the opposite to, again, evade regulation. So despite the evidence, this bill does not acknowledge that e-cigarettes are tobacco, and that's why we oppose.